Okay, so on this question, I will have to make a voice note to make it easier for us to understand. So the question says, which of the following is true about cardiac asthma? Which of the following is true about cardiac asthma? So the first question we ask ourselves is, what is cardiac asthma and what is normal asthma? Because the word asthma, of course, we know is going to trigger our mind to start thinking that they are talking about normal asthma. Now, it is different from normal asthma because normal asthma is said that it is a recurrent attack of difficulty in breathing, a recurrent attack of dyspnea, difficulty in breathing that occurs due to hypersensitivity of the lungs to irritants. Normal asthma is defined as a recurrent attack of difficulty in breathing that occurs due to hypersensitivity of the lungs. That is what it means. So for the fact the lungs are hypersensitive, there's a recurrent attack of dyspnea. And of course, that's where irritant comes in. The lungs are hypersensitive to irritants. Now, of course, that brings about difficulty in breathing, wheezing, respiration, and coughing, and all of that. Those become the sign and symptom of normal asthma. So when you say cardiac asthma is an attack of difficulty in breathing. Cardiac asthma is defined as an attack of difficulty in breathing due to failure of the lungs to empty itself to the left side of the heart. We know that when blood circulates from the right ventricle, it moves to the pulmonary trunk and then to the pulmonary arteries and then to the lungs for oxygenation. After oxygenation, we know that the blood will leave there and go straight to the left atrium and then to left ventricle. So if the left side of the heart fails, meaning it can no more drain blood from the lungs, it will result in congestion. It will result in accumulation of blood and fluid within the lungs. And mind you, we know that within the lungs we have the respiratory region and the conducting region. Talking about tracheobrachial tree now. So when there is now too much fluid or plasma or blood within the alveoli, it will impair gaseous exchange. Impairing gaseous exchange, that will bring about difficulty in breathing, which is referred to as cardiac asthma. So cardiac asthma is an attack of difficulty in breathing that occurs due to accumulation of blood within the alveoli that occur due to the failure of the left side of the heart, because if the left side of the heart fails, it can no more drain blood from the lungs. So that is what we mean by cardiac asthma. So if you look at the option, it says which of the following is true about cardiac asthma? A, it occurs due to bacterial infection. Of course, cardiac asthma is different from normal asthma. So that option becomes out of the way. 2, it occurs due to exposure to irritant. Of course not. We know for sure that cardiac asthma occurs due to failure of the left side of the heart. Normal asthma occurs due to exposure to irritant, like I explained. 3, it occurs due to right-sided heart failure. Of course, no. Cardiac asthma occurs due to failure of the left side. Failure of the right side will lead to pulmonary congestion and not cardiac asthma. So that is for that. And then number 4, it occurs due to left-sided heart failure. So to this question, the answer is 4, which is D, A, B, C, D, which is D or number 4, as some people marked it. So that is that on that question. Thank you. Okay, so responding to number 2 question, a senior nurse knows that the junior staff understand positioning when she places a patient with shock in which of the following position? A senior nurse knows, a senior nurse understands, a senior nurse knows that the junior nurse knows what she is doing when she placed a patient with shock in which of the following position? So the first question is, what is shock? That's the question we should be asking ourselves. We know for sure that shock is defined as hypoperfusion. In a simple term, it means hypoperfusion. That's to say, when there is decreased blood supply to vital organs. When there is decreased blood supply to vital organs, decreased blood and oxygen supply to vital organs, it is referred to as shock, which also means it is referred to as hypoperfusion. The tissues are hypoperfused, meaning they are supplied below normal. Hypoperfusion. And of course, we know that when we say vital organs are unable to get enough blood, of course, we're talking about the heart, we're talking about the brain, especially the brain and the heart. If they are not getting enough blood, enough supply, which position is best to place the patient? That's the question. Now, of course, we know for sure that blood supply from the lower limb takes longer time. What I mean longer time is simply because of force of gravity. So when shock is occurring, we know that in shock we have different phases. We have the compensating stage, we have the progressive phase, of course we have the irreversible stage. Now, at the compensating stage, we say is a phase whereby every organ will compensate by donating their blood to the heart. And the progressive stage is a phase whereby every organ that donated require their blood back. And while the irreversible stage, we say, is a stage whereby every organ that compensated will start experiencing decreased blood supply to themselves. So, in this condition, which position can you place the patient that will promote quick supply of blood to the brain? That is the question. Which position is the nurse expected to place the patient who is having hypoperfusion of blood to the brain and heart that can promote quick blood flow? Number one answer says, place the patient in a flat position. When you place a patient in a flat position, is it possible for the blood to easily get to the brain? The answer is no. Imagine if you buy a Coke that is half, or you buy Coke, and of course Coke, or a bottled drink rather, you've taken some fluid out of it, is now half. If you want the fluid to get to the cover, and if you want that fluid to get to the cover and fill every part of the cover, what position can you place the Coke or the can? That is the question. Because if you lie the can on a flat surface, with the fluid, everything accumulate within the head? The answer is no. So placing a patient in a flat position may not be the best option. 2, Fowler's position. Fowler's position. Now, if you look at the diagram we sent before in our last thing I said, Fowler's is when a patient is sitting down. When a patient is sitting down, we'll call it Fowler's position. If you are sitting upright, we'll call it Fowler's position. Imagine you want fluid to gather within the mouth of the bottle. Do you need to make the bottle to stand erect? The answer is no, because if you make it to stand erect, fluid can never get to the mouth of the bottle. So making the patient to be in a Fowler's position, in a sitting position, will not promote quick blood flow to the head. So Fowler's position becomes out of it. Next is the Trendelenburg position. So this Trendelenburg position is a position where the patient is now lying down with the legs elevated. The patient is lying down with the legs elevated. Now, just like if you want to drink Coke, you want to drink that water, what do? You raise the bottom of the bottle up so as to ensure that the fluid easily get to your mouth. So that is the position. So is this position correct? Let's hold on to it and we'll come back. The next is semi-phallus position. Semi-phallus position is sitting at angle 45. Imagine when you are sitting and you are resting your back. You are not sitting upright, but you are sitting resting your back. Sitting resting your back, will it make quick blood flow? Will it cause quick blood flow to your head and your heart? The answer is no, because you need to ensure that this fluid, this blood easily get to your heart. Why? In sitting in that semi-phallus position or that resting position, force of gravity will pull blood from the head and the heart. Now, next one is left lateral position. Lying lateral position is equivalent to lying flat position, because flat position, lateral position, all of that will not promote quick blood flow to the head, which we want. So the best option to this question is number C, which is the Tredelebourg position. That's to say, you are lying down with your legs elevated. You are lying down with your legs elevated, which will promote quick blood flow to the head and the heart. So in this question that says a nurse, senior nurse knows that the junior staff understand positioning when she places the patient with shock in which of the following. So the answer is C. So that is for that. Thank you.